what do we all know? We all know something very important, right? And that is that the only difference between ovarian cancer and prostate cancer and lung cancer and brain cancer and lymph cancer is the first word. The second word is cancer. The first word is location. The location is the place in which the cells began to change and become chronically fermenting cells. That's the location. And that's what determines a lot of the activity. Depending on the location and the organ, that organ has particular functions and particular drainage patterns and lymphatic pattern, both vascular and lymphatic drainage patterns, and the cells, the like liver cells, do different things than kidney cells and things like that. So based on those characteristics, the chronically fermenting cell in that environment will act somewhat differently. However, the biology, the basic biology, is the same, which is why they call it cancer. And it's why when the pathologist gets the biopsy, they're going to see certain things. There's certain hallmarks. Basically, the study of cellular structure is called histology. Okay, like anatomy. When we talk about anatomy, your heart, your lungs, your bones, we're talking about gross anatomy. Gross meaning large. Microscopic anatomy, you need a microscope, and we're looking at tissues and tissue structure. That's called histology. So the liver has a specific histology, kidneys have histology. So they start to change. They start to change in a certain specific way. And the way in which they change is they develop, this becomes larger and that becomes smaller, and the ratios and blah, 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 blah. So now we say, now this is a chronically fermenting cell, or Rockefeller would call it a cancer. And so that's it. Well, it's genetic. That's not genetic. Because there's no one or three or five genetic aberrations that are specific for and define cancer, define chronically fermenting cell. None. How about zero? Can I be more explicit? However, there is a metabolic component of chronically fermenting cells known by Rockefeller and his family and his team and his ancestors, who call it cancer. And that is called the Warburg effect, aerobic glycolysis. Aerobic glycolysis is the hallmark of chronically fermenting cells. That's not a genetic, that's a metabolic. Ergo, Dr. Thomas Seyfried of Boston University wrote a book called Cancer is a Metabolic. Unfortunately, he used the word disease, but everyone knows it. So anyway, and that's what he talked about. And he talked about how all the things that happen because of this metabolic problem are retrograde going backwards. They go backwards and they modify the genetic expression so that now the cell can exist successfully as having a new metabolic requirement of fermentation, which it didn't have before.